I'm going to, begin with the second part of the, lecture 17 and then through the 18. So, this part is about the how, collagen is organized, okay? And then we are going to talk about very similar fiber, but it's not collagen, that is the elastin. And then we're going to move to the discussion about the proteoglycan. Okay, so this is about the how the collagen, those triple helix, and then fibers are, regulated and then assembled together, and that is, actually it is occurring in this ER here, okay, and ER to the Golgi network. So if you look at this really carefully, this is about collagen, the molecule, but actually when they had, produced, synthesized, and then they have this green area, that is probably what we call a pro-collagen, okay? So, during the assembly, this part will be cut off. It's not necessarily, triple helix or something. So, it will be some modification, glycosylation occurs in the hydrolysin. And then, there will be undergoing modification. And then I think that triple helix assembly begins with still having some pro-collagen domain here. So when they are, secretory pathway, they finish up this, fibrous triple helix, like, one single fibrous collagen molecule forms, and then what will happen is it will be secreted out, but the pro domain will be cut off, okay? So I think the cleavage of propeptide will be cut off, and then they'll have this mature collagen molecule, completed, and then it will be assembled into this big collagen fibers. So, what it is that, this collagens are very insoluble, and then forming a stress, a very strong and then resilient fiber is that they maintain this covalent cross-links in the lysins, okay? In intermolecular cross-linking occurs. So they are forming a very tight, interaction among the collagen molecules in the fibers, okay? And then next is the different type of collagen, collagen type 4, and that is a basement membrane specific ECM molecule. And that is what we call a non-fibrillar collagen. So non-fibrillar collagen, so do they not have the triple helical region? Yes, they do. But the problem is that those triple helical region is interrupted by non-triple helical region. So this, area, the interruption is kind of like a, forming like a hinge, okay, right? So they can fold it back. So it's kind of like a floppy, so they cannot form this like an end-to-end joining and then lateral, cross-linking. So, they do have some lateral association that is very short. So instead of forming like a fiber formation, they will form, like this, and then with the interruption is folded. So instead of forming a fiber, they can form this kind of like a big layer, okay, on one plane layer, and then they can form assembly of layers of the collagen will be formed. So, in the tissue, this embryonic tissue, chicken embryonic tissue here, and then you see this basement membrane right in here, okay? These are the basement membrane. I think that collagen type 4 is assembled in here, so that's how they can form this kind of planar layer. I think there's not only collagen, there are some other proteins in there. And then so you see, this connective tissue. They have a type 1 collagen, so they can see this. You can see these fibers in there. And next is the elastin. That is the connective tissue ECM. This is the cutis laxa. So if you don't have elastin, then this is, you will have this. I think that this is very young, patient, and then tissue does not have electricity. I think at this point you need to just push this bump back, and then they may go back to original position. So that is coming from elastic fiber. So elastic fiber, this is a patient here. So clinical appearance of 15-year-old boy, okay, right, and with a cutis laxa. So that is the elastin fiber defect. I think this is the progeria, okay. That early onset of aging. I think this kind of patient wouldn't live very long, I think about 20 or 30, then mostly have some different failure, cause them to early termination. So elastin fibers are like this. They are very hydrophobic and kind of like a spring like. So when they are relaxed, they are coiled, and then when they are stretched, and then they will be stretched like this, and then it will be relaxed back. So they are composed of elastin, but it's not really homogeneous. Structure is a rubber-like property, and it is hydrophobic, and they form fibers. Okay, and then they have the fibrillin is the one of the monomer, and then plus many more. Okay, that is involved in. So typical disease that coming from this elastin fiber defect is one that we talked about, this cutis laxa, but also Marfan syndrome. It's the also elastin deficiency. I heard that maybe Abraham Lincoln or somebody has this kind of symptoms. So it's really tall, but joint or something is not really strong enough, I guess. Okay, so that is the we finished about 5 collagen-like fibers. I mean, elastin is not collagen. Okay, it's a different protein. But next is a different type of the molecule, that is the proteoglycan. I bet you never heard about proteoglycan, or you heard about it, but you don't really know what that is. Mostly is protein. They have what we call a core protein here, and the core protein is decorated with sugars. Okay, so you have a core protein, okay, and then lots of sugars, something like this. So that is one of this fibers that you are seeing over here. So that is this. Okay, so core protein, okay, and then this is the sugars. Okay, right. So I'm going to move on. Okay, so proteoglycan complex is really important in this cartridge. In cartridge, when you see it, you have this hyaluronan molecule. This is sugar, big sugar, and then the other proteoglycan, which has the core protein, is decorating in here. So this is big molecule you are seeing. Even you have a picture here. So each of them are the proteoglycan molecule. Also, it's a chondroitin sulfate and a keratan sulfate. A sugar molecule attached to certain core proteins. It's like could be aggrecan or decarin or something like that. So if you look at those proteoglycans, it has a feature. So that is the glucosaminoglycans. Okay. So we'll talk about what is the glucosaminoglycan, and those proteoglycan is like a. So I'm sure that you might wonder what this guy is talking about. Okay. So proteoglycan is the important in a way that it has a lot of sugar attached to it. So okay, so you may think that sugar is just a sugar. I mean, what's the deal? So sugar has the property. Think about it. You can make glue out of sugar, isn't it? So it's very tacky. So certain core protein is holding a lot of sugar. It means that the unit can be very tacky to other molecules. So first of all, it will hold a lot of water, and then it can be attached to the cell very well, very non-specific actually. And then they can hold a lot of different factors. Small molecule can attach to it. Think about it. I mean, tacky surface, a lot of dust and everything can bind to it, right? And then it is important for formation of tissue. I think that it's more like creating cushion, between the tissues, space, so that it's very porous space, so that something that can be communication or like a flow through kind of thing is very important. And molecularly, they are very highly charged and hydrophilic, okay, and forming gel-like structures, okay. So it is very, very important. I mean, it can hold anything in the outside of the cell. So you might wonder, what is the proteoglycan and then the glycoprotein? So here is the glycoprotein and here's the proteoglycan. They are comparing it. Let's see a couple of them, okay? So proteoglycan is a compound consisting of, I'm reading number 1 now. Protein bonded to a glucosaminoglycan, that is a GAG, right? Groups. Present especially in connective tissue, yes. There's one proteoglycan in the basement membrane, but that is only one kind. And any class of proteins which have the carbohydrate group attached to the polypeptide chain, there is a glycoprotein. So, small proteoglycan can be, glycoprotein too. And non-protein contents is 50 to 60% by weight. So the majority of weight is coming from sugar. And the non-protein contents is less than 10 to 15%, okay, in glycoprotein. And then attached to a protein to form a proteoglycan, attached to a protein to form a, glycoprotein. I mean, in a way that's very simple, but function is coming from the proteoglycan is coming from sugar, right? And chains attached to a long, linear, and negatively charged. Chains attached to a short, branched, and then may or may not be negatively charged. That is the glycoprotein. I want you to read 5, 6, and 7, and 8, okay? Then I'm going to finish this segment, and then I'll see you next time. Thank you.